Hello, everyone out there in the YouTube land. My name is Matthew Crockett, and I would like to let people know about my medical disorder that I have. It is called Becker Muscular Dystrophy, and I would like to explain what it does and why it's a problem, and just anything that you would like to know about it. I would like to share it with everyone. So here goes. Becker muscular dystrophy is an inherited disorder that involves slowly worsening muscle weakness of the legs and pelvis. What are the causes? Becker muscular dystrophy is very similar to Duchenne muscular dystrophy, except that it gets worse at a much slower rate and is less common. The disorder is passed down through families. It's inherited, basically. Having a family history of the condition raises your risk. But let me tell you this. Becker muscular dystrophy occurs in about 3 to 6 out of every 1,000 births. The disorder is found mostly in boys and men. Here are the symptoms of Becker muscular dystrophy. Females rarely develop symptoms. Males will develop symptoms if they inherit the definitive gene. Symptoms usually appear in boys between ages 5 and 15, but may begin later. Here's some more about it. Muscle weakness of the lower body, including legs and the pelvis area, slowly gets worse, causing... Here are some of the things that it causes. Difficulty walking that gets worse over time. By age 25 or 30, the person is usually unable to walk. And then there's frequent falls, difficulty getting up from the floor and or climbing stairs, difficulty with running, hopping, and jumping, loss of muscle mass, and toe walking. Muscle weakness in the arms, neck, and other areas is not as severe as in the lower body. Here are some other symptoms that may happen, where you'll have breathing problems, cognitive problems. These do not get worse over time. And then there's fatigue, and the loss of balance and coordination. And you ask, and I've wanted to know this as well, are there any kinds of exams and tests that people take? So let me tell you some of the exams and tests. The healthcare provider will do a nervous system, neurological, and muscle examination. A careful medical history is also important because symptoms are similar to those of Duchenne muscular dystrophy. However, Becker muscular dystrophy gets worse much more slowly. And this is what you might find in an exam, or that your doctor might tell you. There might be abnormally developed bones, leading to deformities of the chest and back, also known as scoliosis, abnormal heart muscle function, cardiomyopathy basically, congestive heart failure or irregular heartbeat, arrhythmias, which is kind of rare. Muscle deformities that can happen are contractures of heels and legs, abnormal fat and connective tissue in calf muscles, muscle loss that begins in the legs and pelvis, then moves to the muscles of the shoulders, neck, arms, and respiratory system. Tests that may be done include a CPK blood test, electromyography, an EMG, nerve testing, muscle biopsy or genetic blood test. And that is pretty much what Becker muscular dystrophy is and what it can do to a person, pretty much. I mean, I know a lot of it has happened to me. But, I am strong. I do the best I can with what I have. And I'm going to read you a little bit more about some possible treatments. Right now, there is no known cure for Becker muscular dystrophy. The goal of treatment is to control symptoms to maximize the person's quality of life. Some doctors prescribe steroids to help keep a patient walking for as long as possible, which they did do that for me. And I walked up until I was probably about 14 or 15 years old. And they say, activity is encouraged. Inactivities, such as bed rest, can make the muscle disease worse. Physical therapy may be helpful to maintain muscle strength. Orthopedic appliances such as braces and wheelchairs may improve movement and self-care, which I do use an electric wheelchair to get me around. And basically it's my magic legs, to be honest with you. That's what I call it anyway. And here's another thing. Genetic counseling may be recommended. Daughters of a man with Becker muscular dystrophy may carry the defective gene and could pass it on to their sons. And if you are having a problem understanding the situation, or you need help, there's things such as support groups. You can ease the stress of your illness by joining a support group where members share common experiences and problems. See mda.org for more information. And here's the outlook for the prognosis. Becker muscular dystrophy leads to slowly worsening disability. Although the amount of disability varies, some men may need a wheelchair, while others may only need to use walking aids such as canes or braces. Lifespan is usually shortened because of heart and breathing disease. And I'm just going to read you a couple more things about muscular dystrophy, about Becker. The possible complications. Heart-related complications such as cardiomyopathy, lung failure, pneumonia, or other respiratory infections. Increasing and permanent disability that leads to decreased ability to care for self and decreased mobility. All right, and pretty much I just wanted to pretty much let everyone know about what I have in my situation. So if there's anybody that has any questions or anything, please feel free to comment or write to me and I will get back to you. Thank you very much. I am Matt Crockett.